Hyperthyroidism. It is a condition where the thyroid gland produces excessive thyroid hormones T3 and T4, leading to an overactive metabolism. So, it is a condition of thyroid gland producing excessive thyroid hormones. So, there are many causes of hyperthyroidism. For example, first, Graves' disease. What is Graves' disease? It is an autoimmune disorder that stimulates excessive hormone production. How does it produces? How does it creates this phenomenon? So there are in Graves' disease there are autoantibodies such as TSI, thyroid stimulating immunoglobulins, which act as TSH, which directly stimulate TSH receptors and increases T3 and T4 production. So this is about Graves' disease. And then there is toxic multinodular goiter. So it is a multinodular goiter. It has multiple. In this condition there are multiple thyroid nodules due to abnormal growth of thyroid follicular cells. It may be benign condition, but the nodules are hyperactive. They increase T3 and T4 production, and after some time they can become autonomous. Means they have no feedback control. They are under no feedback control. They act on their own. Then next condition is next cause is thyroiditis. It is an inflammation of thyroid gland. In most cases, it is an autoimmune condition. Body attack thyroid gland, which leads to inflammation, which leads to destruction of gland, and which releases hormones from the gland in the blood, causing temporary hyperthyroidism. Then there is excessive iodine intake from diet or medications. For example, amiodarone. So this excessive iodine intake will increase thyroid hormone from source other than thyroid gland. And there is pituitary adenoma. In this condition, it is a tumor in the pituitary gland which may stimulate excessive thyroid production by increasing TSH. Increasing TSH will stimulate TSH receptors and will increase T3 and T4 in the blood. So these are all the causes of hyperthyroidism. And then we have symptoms. Then symptoms of hyperthyroidism. So there is very easy mnemonic to remember the symptoms of hyperthyroidism. It is sweating. So as for sweating, weight loss, emotional instability, anxiety, irritability, appetite increased, tremor, tachycardia, intolerance to heat, nervousness, goiter, GI problems like diarrhea. So these are general symptoms due to increased T3 T4 levels in the blood. So and there are eye symptoms. There are these. This is very special in hyperthyroidism, especially in Graves' disease, naming it as a Graves ophthalmopathy. So there are various eye signs. It is very difficult to remember. So there is mnemonic for this remembering eye signs. It is dull vision. It is called dull vision for dull D for limbal sign. Upper eyelid retraction leads to wide eye stare. Then there is U can compare it to V, von Graffi sign. Upper eyelid lag on downward gaze. Then there is L for lid lag, L for lag ophthalmos, V for von Graffi sign again. Upper lid lag with downward gaze. Then there is I for inferior scleral show, S for Stilwell sign, I for Joffrey sign. Joffrey sign for absent forehead wrinkling when looking up. Then there is O for ophthalmoplasia, and N for M for Mobius sign, weak convergence of eyes. Then these are the symptoms. These are various symptoms of hyperthyroidism. Then we come to diagnosis. So for diagnosis, we use various tests. First is blood test. In blood test, we check for TSH, thyroid stimulating hormone. So it is low in hyperthyroidism. Why? Because of the negative feedback of the excessive thyroid hormones produced in hyperthyroidism by various causes. Excessive thyroid hormones will go to pituitary glands and inhibit the secretion of TSH. So it will decrease the TSH in the blood. So there is low TSH in hyperthyroidism. Then we check for free T3 and T4. Free T3 and T4 means they are unbound forms, active forms, which are elevated in hyperthyroidism. This confirms the diagnosis. Then we can also check for thyroid antibodies. So this is usually done for grave disease. To check as it is an autoimmune condition, it produces TSI. It is an auto antibody which acts as TSH. So we also check thyroid antibodies in blood. Then we do a test called radioactive iodine uptake test. What does it do? It tells how much iodine the thyroid absorbs over a set period. So it measures iodine absorption. It is used to differentiate causes. How? In Graves' disease. Graves' disease is a diffuse condition. It's the diffuse condition of whole gland. It involves whole gland. So in this condition, radioactive iodine will be concentrated in everywhere in the gland. So it will in a diffuse form. While a toxic multinodular goiter, in toxic multinodular goiter, there are multiple nodules in the gland. Not every part of the gland have nodules. So radioactive iodine will localized in a particular location in the gland. So it will be localized. So radioactive iodine test is absent. Means it iodine is not uptaken by the gland in conditions such as ingestion of drugs containing thyroid glands. So it is an ectopic source of thyroid hormones from the drugs. So here thyroid gland is not involved. So radioactive iodine will not go in the thyroid gland. Then the next we can do is thyroid ultrasound. It is used for nodules or inflammation, to check nodules or inflammation. And we can use MRI CT scan in rare cases for pituitary gland abnormalities, such as pituitary adenoma. Then so this is all about diagnosis. Then the treatment options. In treatment options, what are the treatment options? Medications are there, radioactive iodine therapy is there, surgery is there. So I am giving a brief overview of treatment. Medications. In medications, we use anti-thyroid drugs such as methimazole, propylthiouracil, which reduces hormone production. And there are beta blockers. Beta blockers will reduce the symptoms produced due to T3 T4 hormones. Beta blockers such as propranolol, atenolol to control symptoms like palpitation and tremors. Then radioactive iodine therapy. It destroys the overactive thyroid cells, leading to reduced hormone production. Often results in hypothyroidism, which may lead to a hypothyroid condition for life, which may requires lifelong thyroid hormone replacement. Then there is surgery, thyroidectomy. It can be partial or complete removal of thyroid gland. Recommended if medication is ineffective or it is large or cancer is suspected. So this is a brief overview of the treatment. Then we see complications if untreated. Complications can be thyroid storm, osteoporosis, heart complications, eye problems. So thyroid storm, a life-threatening emergency with high fever, rapid heart rate and confusion. We will see thyroid storm in next video. As osteoporosis, long-term excess thyroid hormones weakens bone. The heart complications. Heart complications. Why? Because there is increased BMR in the body due to increased T3 and T4. Increased BMR will increase the heart rate and everything related to heart, increasing the stroke volume, increasing the cardiac output, which may lead in long term to atrial fibrillation, heart failure, increased risk of stroke. Then there are eye problems such as Graves' ophthalmopathy we just saw above, vision loss in severe cases. So there are complications. And what are the lifestyle modifications or lifestyle and home remedies which we can do in hyperthyroidism? So in first simple is balanced diet. Avoid excessive iodine rich foods such as seaweed, iodized salt. Regular exercise helps to manage symptoms but avoid excessive exertion. Stress management, yoga, meditation, relaxation techniques help control symptoms. Quit smoking. Smoking worsens thyroiditis. So these are lifestyle and home remedies. And prognosis. With proper treatment, most people manage hyperthyroidism effectively. However, untreated illnesses can lead to severe complications, which we just saw here. So, thank you. This is the video of hyperthyroidism. This is a short, brief, and concise video. It will be useful to revise the hyperthyroidism in a short way and easy way. You can also write this answer in SAQ or LAQ, and these symptoms such as for eye symptoms can come in SAQ, short answer questions, in your university questions, and it is easy way to remember. It can also be used in Viva uh, theory. So thank you. Please subscribe my channel. Thank you.